the fifth webinar in our series on mental health conditions, specifically from a family medicine perspective. And today we're going to be particularly using at alcohol misuse, and the official name for that will be the alcohol use disorders, but we'll go a little bit into terminology today as well. And this is particularly relevant as we are now going into the silly season, and especially with you guys doing lots of calls in accident and emergency, you're going to be seeing a lot of alcohol and its contribution to a lot of the stuff that you're actually looking after. So I'm going to be covering in quite a lot of detail. I've got quite a lot of slides, and we'll be dividing it up into different sections when I upload the webinar, so one can actually watch it in little bits. But we're going to be focusing on just talking in terms of how much alcohol is how much, what is happening in South Africa, the impact of alcohol, how we classify alcohol use disorders. We're going to talk quite a little bit about understanding why heavy drinking and addiction happens. And then we're going to look at the medical management, which is very much about managing DTs and Varnick and all of that sort of stuff. And then also the non-medical management. So firstly, we're going to look today, and just in terms of South African epidemiology, I haven't even looked at the global statistics, but being able to understand the impact of alcohol in South Africa. And what's interesting is that not everybody drinks. So actually in South Africa, only 43% of men and 20% of women in South Africa drink alcohol. And this is obviously looking at our complete population. So that will include children and elderly. But there's a lot of people, for example, for religious reasons or for all kinds of reasons, cultural reasons, may not even drink alcohol at all. So actually all the alcohol is consumed is by only a certain part of our population. But in terms of causing trouble, if you look at substance abuse centers across South Africa, if you're talking about substance use disorders, alcohol is the biggest problem in South Africa. And actually the other substances makes up a small number. So this is just when we measure alcohol, they always measure it in what they call absolute alcohol levels, which is 12 grams, and that we can sort of consider one standard drink or 1 unit. And then if you look at the sort of take the average of how much we drink in South Africa, it constitutes to about 64 grams of absolute alcohol per day. And this just helps us to compare it to Africa and globally. And South Africa, in terms of the amount of alcohol that gets consumed per capita, is some of the highest in the world. In terms of those people who do drink, certainly more what we call heavy drinking is where the problem comes in. So although social drinking is quite a bit across the different genders, particularly heavy drinking is more heavily in men. So 70.8% of men who drink and 33.7% of women qualify for what we call heavy drinkers. And you look at the pattern of drinking, which includes heavy drinking, WHO scores South Africa as among the riskiest drinkers in the world. We get 4 out of 5, with 5 being the most riskiest. From those people that are drinking, 11.4% will officially meet the criteria for alcohol abuse or hazardous or heavy drinking, and 2.6% of them will actually be dependent on alcohol. So what's interesting, and this is important from the industry point of view, is that the industry will often say, well, we are providing alcohol for social recreation and we can't help the few that, you know, are heavy drinkers. It's their responsibility. But if you look at all the absolute alcohol sold, and this was a study actually done in Tshwane, 93.9% of that alcohol is consumed by heavy drinkers. So the alcohol industry makes all of their money from the heavy drinkers, not the social drinkers. And that's just... yeah, we'll get to that a little bit later. But if you can see there, although 43% of men and 20% of women in South Africa only drink, that's different for students. So this was from some universities. Interestingly, most of the students that responded to the survey was Faculty of Health Sciences, probably because it was done by the Faculty of Health Sciences, the study. And 80.6% of students do use alcohol during their varsity years. 6.7.5 to 11% will actually classify as harmful or high-risk use. And there was 8.6% that if you use the actual dependence, which actually had alcohol dependence amongst our students. So an issue also affecting our young people. So if we look at what people drink, so the majority is still mostly beer and cider, and about wine second, and spirits the third most popular. So let's just look at the impact of alcohol. And obviously, if we know that alcohol has actually an impact on your health, we always talk about the liver, but it's definitely a risk factor for cardiovascular disease. It's actually implicated in 4.4% of all cancers diagnosed, has a specific relationship to alcohol. And then, of course, it contributes to a wide range of mental health conditions. We also know that partly due to risky behavior and the way people conglomerate around alcohol, there's a higher transmission and progression of infectious diseases. We've seen neurological illnesses like Vernix because of alcohol. It contributes to malnutrition, not taking your treatment properly, which complicates all kinds of other things. And then very concerningly, South Africa has the highest fetal alcohol syndrome rate in the world, and in particular areas as high as 29%. So when you look actually at our death and disability statistics, alcohol is sitting at the 5th leading cause of death and disability in South Africa. That was the 2015 stats. Very relevant to you guys is its impact in terms of trauma and injuries. So they've shown that 40% of all visits to the emergency department has got something to do with alcohol playing into the issue. And of course, our road traffic fatality rate has been directly linked to the alcohol use. So South Africa has a very high RTA rate. And when you look at mortuary data of people who die, approximately half of those is alcohol related. And that is people who actually had alcohol in their system when they died. It doesn't even talk about other people that were involved in that accident. And therefore, alcohol attributable deaths is the biggest thing that kills people between the ages of 20 and 39. And then, of course, it has massive social impact. So it has a huge effect on relationships. Oh, apologies. Let me just reshare that. There we go. It has a huge impact on gender-based violence. So again, South Africa is also one of the highest gender-based violence rates in the world, and binge drinking considerably increases both the severity and the frequency of partner abuse. Alcohol definitely escalates a quarrel, so especially if both partners have been drinking. And then, of course, alcohol also contributes to problems like infidelity or financial problems or poor, which makes the quarreling worse, contributes to why people quarrel. And harmful drinking is actually linked to a lot of the drivers of gender-based violence, including gender inequitable masculinity, poverty, depression, childhood trauma. And so, for example, women who get beaten up are more likely to drink. And if you're drinking, you are more vulnerable to possibly getting beaten up. And so it's very much a vicious cycle. So if we talk about addressing gender-based violence in South Africa, we actually have to really look at addressing what's happening with heavy drinking. Parental alcohol use have very much been linked to negative parenting and have definite influences on child's cognition and behavior. There's a lot of evidence for that. And of course, it can also lead to financial challenges, just the amount of money that you spend on alcohol, but also issues in terms of functioning at work and as a contributor to unemployment. It's quite heavy when we look at all the impact that alcohol does have on our society. So let's start looking at quantifying drinking, and that becomes important when you're assessing